Top 5 signs your bladder is weak. Do you often rush to the bathroom, wake up multiple times at night, or feel like your bladder isn't fully empty? These could be signs of a weak bladder. In this video, we'll uncover the top 5 signs of bladder weakness and simple ways to regain control naturally. Frequent urination. Frequent urination is one of the earliest and most common signs of a weak bladder. If you find yourself going to the bathroom more often than usual, especially more than 7 to 8 times during the day, it may indicate that your bladder muscles are losing strength or your bladder capacity is reduced. A weakened bladder can't hold as much urine, causing you to feel the urge to urinate more frequently. This can affect daily activities, work, and even social life, as you constantly feel the need to locate a restroom. Over time, it may also disrupt sleep if frequent trips extend into nighttime. Several factors contribute to frequent urination, including age-related muscle weakening, dehydration patterns, excess caffeine or alcohol, and medical conditions such as diabetes or urinary tract infections. Identifying the underlying cause is important to prevent further bladder strain. Strengthening your bladder can be achieved with simple lifestyle adjustments. Regular pelvic floor exercises, Kegels, help improve muscle tone while managing fluid intake, and avoiding bladder irritants like caffeine and alcohol can reduce urgency. Staying hydrated without overloading the bladder is also crucial. Tip: if frequent urination persists or worsens, consult your healthcare provider. They can rule out medical conditions and guide safe strategies to restore bladder strength. With consistent care and exercises, many people experience noticeable improvements in bladder control, reduced urgency, and better quality of life. Sudden urge. A sudden, strong urge to urinate is a clear sign that your bladder may be weakening. Unlike normal urination, which occurs predictably, a sudden urge hits unexpectedly and can feel almost impossible to ignore. This urgency often leads to rushing to the bathroom, sometimes resulting in minor leaks if a restroom isn't immediately available. This symptom occurs when the bladder muscles or nerves that control urine storage are overactive or weakened. The bladder may contract involuntarily, signaling a strong need to empty even when it's not full. Over time, repeated urgency episodes can increase stress, anxiety, and embarrassment, affecting daily life and sleep quality. Common triggers include caffeine, alcohol, acidic foods, and excess fluid intake close to bedtime. Medical conditions like urinary tract infections, diabetes, or overactive bladder can also contribute to sudden urges. Identifying triggers and modifying lifestyle habits is essential for relief and prevention. Pelvic floor exercises, commonly called Kegels, strengthen the muscles that support the bladder and help control urgency. Scheduling regular bathroom visits, even when you don't feel the urge, can train your bladder to hold more urine comfortably. Avoiding irritants like caffeine, alcohol, and artificial sweeteners can further reduce sudden urges. Tip: if sudden urgency occurs frequently, consult your healthcare provider to rule out medical causes. With consistent exercises, dietary adjustments, and behavioral strategies, you can regain bladder control, reduce sudden urges, and enjoy a more comfortable, confident daily life. Leaks and dribbles. Accidental urine leakage, whether a few drops or more noticeable dribbles, is a common sign of a weak bladder. This can happen during coughing, sneezing, laughing, or even when standing up after sitting for a while. Leaks occur when the pelvic floor muscles and bladder sphincter lose strength, reducing your ability to control urine flow. Bladder leaks can affect confidence, social life, and sleep, making daily activities stressful. Many people hesitate to talk about it, but recognizing it as a symptom of weakness is the first step toward improving bladder health. Common causes include age-related muscle weakening, childbirth, menopause, prostate issues in men, or nerve-related conditions. Simple lifestyle changes and exercises can significantly reduce leaks. Pelvic floor exercises, Kegels, strengthen the muscles that control urine flow, improving bladder control over time. Avoiding bladder irritants like caffeine, alcohol, and carbonated drinks can also reduce episodes. Maintaining a healthy weight lessens pressure on the bladder, decreasing leaks. Behavioral strategies, like timed voiding, scheduling bathroom visits, can retrain the bladder to hold urine longer and prevent unexpected dribbles. Wearing absorbent pads temporarily can help manage leaks while working on strengthening exercises. Tip: if leakage persists or worsens, consult a healthcare professional. They can identify underlying medical issues and recommend safe interventions. With consistent pelvic exercises, proper hydration, and lifestyle adjustments, leaks and dribbles can be greatly reduced, improving confidence, comfort, and quality of life. Nighttime bathroom trips. Waking up multiple times at night to urinate, known as nocturia, is a common sign of a weak bladder. Frequent nighttime trips disrupt sleep, leaving you tired, less focused during the day, and more prone to accidents or falls. A healthy bladder should comfortably hold urine throughout the night, so repeated interruptions indicate reduced bladder capacity or weakened control. Several factors contribute to nighttime urination. Excess fluid intake before bedtime, caffeine, alcohol, and certain medications can increase urine production at night. Age-related changes in bladder and kidney function may also cause nocturia, along with conditions like diabetes, sleep apnea, or urinary tract issues. Identifying the cause is essential for effective management. Lifestyle adjustments can significantly reduce nighttime bathroom trips. Limiting fluids a few hours before bed, avoiding bladder irritants like coffee and alcohol, and practicing pelvic floor exercises strengthen bladder control. Elevating your legs in the evening can help redistribute fluids from the lower body, reducing nighttime urgency. Behavioral strategies, such as timed voiding during the day, can improve bladder capacity and decrease nighttime interruptions. Keeping a sleep-friendly environment and maintaining a regular bedtime routine also support better rest. Tip: persistent nocturia should be evaluated by a healthcare provider to rule out underlying conditions. With consistent lifestyle changes, bladder exercises, and careful fluid management, many people experience fewer nighttime trips, improved sleep quality, and greater confidence in bladder control. Subscribe and turn on notifications for more tips on bladder health, pelvic strength, and senior wellness. Incomplete emptying. Feeling like your bladder isn't fully empty after urination is a common sign of a weak bladder. This sensation may occur even after visiting the bathroom multiple times, leaving discomfort, urgency, and sometimes dribbling afterward. Incomplete emptying can increase the risk of urinary tract infections, as stagnant urine provides a breeding ground for bacteria. This symptom often results from weakened bladder muscles or reduced coordination between the bladder and pelvic floor muscles. Age, nerve issues, prostate enlargement in men, and certain medications can also contribute to incomplete emptying. Recognizing this sign early is important to prevent complications and improve bladder function. Simple interventions can help reduce the sensation and improve complete emptying. Pelvic floor exercises, Kegels, strengthen the muscles controlling urination and support bladder emptying. Double voiding, a technique where you urinate, wait a few seconds, and then try again, can also help fully empty the bladder. Maintaining healthy fluid intake is important. Drink enough water to stay hydrated, but avoid excessive fluids close to bedtime. Avoiding bladder irritants like caffeine and alcohol can reduce urgency and improve bladder control. If incomplete emptying persists, consult a healthcare professional to rule out conditions like urinary retention, prostate issues, or nerve-related problems. Tip: with consistent exercises, behavioral strategies, and medical guidance if needed, you can regain better bladder function, feel more comfortable, and reduce the risks associated with incomplete emptying. Strengthening your bladder improves confidence, sleep quality, and overall quality of life. Recognizing these signs early is the first step to strengthening your bladder and improving daily comfort. Try exercises, lifestyle adjustments, and hydration strategies to reduce urgency and leaks. Comment below which sign you relate to most, and don't forget to like, share, and subscribe for more bladder-friendly tips.